Hi, my name is Jacqueline Lucas, and today I'm going to be explaining injections to you. So I just checked on the computer, and I have an order from the physician for Mr. Ben Sick that he has 3 injections due. First is a TB injection, the next is his morning insulin, and the final injection is a B12 injection. So I'm going to go through the injection guide, which is a little bit tedious, but hopefully we'll get it done as quick as possible. So I would make sure to wash my hands, and we are in the med room preparing these injections. So the first type of injection for the TB is an intradermal injection. The needle gauge is 26 to 27. The needle length is 1.5 to 1/4 of an inch. I would make sure to inject at an angle of 5 to 15 degrees, and I would do not aspirate on these injections. The max amount that you can draw back is 0.1 ml, and the sites are the forearm or the upper back, and we use intradermal injections for allergy testing or for TB skin testing, like we are today. So I would open my alcohol package, scrub the top of this, draw back 0.1 ml, and inject, and then pull back, and then making sure not to stick myself in the process. The next injection for the insulin, I would make sure to verify again the doctor's orders, and there is an order for 40 units of insulin. So for this injection, this is considered a subcutaneous injection. We use these for insulin or for heparin. If I were to be injecting heparin, I would make sure to have another RN verify the amount and co-sign for me. So this is this type of needle, the gauge is 25 to 27. The needle length is 3/8 to 5/8. The angle that I inject on a patient that I can pinch 2 inches of skin is 90 degrees. For a thinner patient, if I can only pinch 1 inch, I would inject at 45 degrees. You do not aspirate on these injections. The max amount that you can draw back is 1 ml, and the sites are the outer arms, the subscapular, abdomen, and then the inner thighs. So I would make sure to swab, insulin vial, draw back 40 units, uncap, inject, draw back, and then make sure to recap the needle, and the insulin is prepared. The last injection is for the vitamin B12. Now, since this is an IM injection, we have various choices for where we can inject this. So the first IM site is the deltoid. The gauge of that needle is 21 to 23. The length is 1 to 1.5. You would inject at an angle of 90 degrees. You do not aspirate on the deltoid. That is new based on evidence-based practice. The max amount that you can draw back is 1 ml, and the sites is the deltoid. So on the arm, you locate the acromion process 2 finger widths down. It's the triangular muscle in this area. So I'm going to prepare only one of the IM injections. So I'll draw back 1 ml. So on the site, let that dry. Uncap. Inject. Draw back. And then recap my needle. Other options for the injection are also the ventral gluteal. The gauge of this is 21 to 23. The length is 1.5 to 2. The angle that I would inject that at is 90 degrees. You do aspirate on this injection, and the max amount that you can draw back is 3 mLs. And the site is, for ventral gluteal, is you put the thumb towards the nose, and then 1 finger is on the anterior superior iliac spine, and then 1 is on the iliac crest, and you would inject within the V, which I will demonstrate. And then the last injection is the vastus lateralis. Yes, the gauge for that is 21 to 23. The length is 1.5 to 2 inches. The angle that we inject at is 90 degrees. You do have sprayed on this injection. The max amount that you can inject is 3 mLs, and the site is the vastus lateralis muscle. When you would locate that by one palm on the greater trochanter, one towards the knee, move one in, and go out. So, I'll gather my supplies and we will do this injection. So, make sure to wash my hands. My supplies are gathered. Hello, Mr. Ben Sick. How are you doing today? Just doing all right?
Yeah, I mean, I'm in the hospital.
That is true. So I would provide privacy. I would make sure that there's adequate lighting in the room, make sure that my bed breaks are on, and then I will raise the bed to a comfortable working height. This is always the fun part because it takes a little while. Okay, we're just gonna sit you up. So, could you please verify your name and your birth date for me?
I'm Ben Sick, and today's my birthday, and I'm 84.
Today's your birthday. Well, I'm sorry that we gotta give you a couple of injections, but hopefully the vitamin B12 will give you a little bit of energy. So how do you feel about that?
Yeah, whatever.
Okay. Well, do you have any questions about the injections that I'm about to give? So what you have ordered is a TB test. That's just a skin test to see if you've encountered tuberculosis. The next injection is your insulin, which you're used to. And then the new one is the vitamin B12 injection. So, and that is an IM injection, so I'll be giving it in your arm.
That's fine.
That's fine? Okay. So my hands are washed. I make sure to grab gloves. I'm going to take and set my lovely supplies out. Okay, so the first injection that we're going to be giving is your TB skin test. So, I'm just going to stick your arm out. Swab the arm with alcohol, making sure to let that air dry. So while that's drying, I'm going to grab my injections.
Was it for honor?
And put on my gloves.
Those gloves are tricky when your hands are wet, aren't they?
Yeah, that's true. That's true. So are any of your family members visiting for your birthday?
Yeah, everybody's coming in.
Well, that's exciting.
There's going to be 62 people here today.
Oh, 62. I don't know if you're allowed that many to visit, but we can have a couple people in here at a time. We'll just have to keep filing them through.
Okay.
Okay, so when you give this injection, you make sure that you give it bevel up. So an angle of 5 to 15 degrees. Inject. Okay. And then I would put that in the sharps container. Okay. Next is your insulin shot. So I'm going to be giving this to you on your abdomen. Is that okay with you?
Yeah.
Okay.
Don't know where else to give it.
Just move the injection pad. So while that's drying, I'm going to pinch the skin, inject 90 degrees. Sharps container. Okay. And the last injection, your vitamin B12 injection. I'm going to be giving this in the leg. So is your left leg okay?
Mm-hmm.
Okay. Let that dry. Okay. So when giving this injection, you make the C, you dart in 90 degrees, you pull back and aspirate, there isn't any blood, inject, pull out, sharps. And we're finished.